I'm a humanitarian worker, a medical humanitarian worker, working for Doctors Without Borders. So what is progress for us, for the people who we work for? So we work for people that are excluded and vulnerable. People who are sick. Now, progress, you could say there will be no illnesses. Of course, this is ridiculous. So that would be naive to say this. So what is progress for us is that people that are vulnerable and excluded of care would have better access to healthcare in the world, especially in rural areas, especially in minorities, in areas where there is no proper healthcare. And that does not mean very sophisticated healthcare, but access to proper healthcare free of charge, where poor people can go to somebody that cares for them. Access to healthcare should be free of charge in areas where people are very poor. What we see, if people have to pay for healthcare, that they delay going to a doctor or a nurse, they get more sick, and you get into a negative spiral. So first of all is the financial accessibility. Then the geographical accessibility is important. So in rural areas, take Congo, people have to travel very far to come to a proper hospital or larger health center. Why? Because the budgets for healthcare are relatively small. So how much attention is there for proper healthcare in the world to have people geographical and financial access to healthcare? And that links then to the pharmaceutical company, where medication is very expensive. So, but also the distance, the qualified of staff, how much money do we put into paying health staff properly? Because a lot of health staff never receives their salaries in the world, so they will do they have to work on their farm, so the health center is closed in the afternoon. So there's a lot of debt that all goes with access to healthcare. One of the larger group of people that we work for are women and children. So another real progress in the world, and of course the topics that I talk about are very large topics, because we work in the world and we can, as I say, we can dream that there are no illnesses. Of course this is ridiculous. But for women, what would be real progress, that women have real choice on their sexual health. What does this mean? That they have a real choice on taking contraceptives, and if they need a safe abortion, that they have access to it. So this is also something that is very, very complicated in this world. There's a lot of taboos and judgment on the women, and that would be real progress if women have real choices on their sexual health. The progress made on HIV treatments, the money is being withdrawn for the moment. So progress made can also collapse. So you get sometimes in the donor community a hooray, we're there, we've reached it, we didn't. So that's one element. The other element where we see a challenge in the world today, there's a lot of nationalism and of governments and states going back to themselves. This can have an effect on our work that would exclude people even more, minorities, and that we criminalize those that flee certain contexts. And there I come to the migration topic. So there, the number of people that flee their homes is bigger than ever, but in the same time they're being criminalized because they're being accused almost of leaving their home to go somewhere else. And that we see as a major challenge, and us trying to help these people are also being accused of being a factor in this migration. So that is the other element where we see a degradation, I would say, or a challenge in progress, is the respect of what we call international humanitarian law. So also here we could be naive and say there should be no violence, there should be no wars. Of course that is not a good statement to make. That progress we will not make in the world. But given the fact that there is war, then there are rules during these wars. And us being medicals that work in war situations, we work under a framework of law that protects our work and that protects victims. And we see in the wars of today that we call them wars without limits. So these rules, and they are under the Geneva Convention, they are no longer respected. So what does this mean concretely? Ambulances are being bombed, hospitals are being bombed, doctors and nurses are being killed, and patients are taken away from the hospital. So they're identified as belonging to one group or another and taken away. And there we need to make progress, because we made, what is the negative of progress? We degrade it in terms of respect of international humanitarian law, and we should go back to the respect of that law framework.